Hello everyone, my name is Anahan and today I would like to present my research on depression to the family members of adolescents experiencing depression. Before that, I would like to do the acknowledgement to the country. I would like to begin by acknowledging the traditional owners and custodians of the land on which we meet today, the people of the nation, and pay my respects to their elders past and present, as well as to emerging leaders. I extend the respect to Aboriginal and Torres Strait Islanders here today. The purpose of this presentation is to provide comprehensive yet accessible understanding of adolescent depression. What is it, how it affects in young people and their families, and how theory can guide us in effective way strategies to support them. Through this discussion, we will explore both the theoretical and practical dimensions of depression, drawing upon evidence-based perspective to clarify its causes, manifestations, and potential interventions. Furthermore, I will introduce the cognitive theory of depression developed by Aaron Beck and explain how it constructs help us understand depressive thought patterns in adolescence. Finally, we will discuss interventions that translate theory into a meaningful support with the goal of promoting healthier emotional and cognitive function for adolescents. The definition of the depression is it can be defined as a mental health disorder characterized by persistent sadness, loss of interest or pleasure in usual activities, and inability to carry out daily tasks for at least 2 weeks. Individuals often experience several of the following symptoms: low energy, changes in sleep, appetite, patterns, anxiety, poor concentration, indecisiveness, restlessness, of guilt or hopelessness, and thoughts of self harm and suicide. Adolescent depression, in particular, is both frequent and concerning. Approximately 10 to 20% of adolescents experience depressive symptoms, making it one of the most common mental health conditions in this age group. The leading contributors to depression in young people include neuropsychiatric factors, biological changes, family conflict, academic stress, and social pressures, all of which can disrupt healthy development, learning, and social participation if untreated. Depression typically emerges after the age of 14, and researchers have identified as it is one of the most alarming new morbidities of adolescence disorder. The disorder not only affect emotional well-being but can also interfere with identify formation, interpersonal relationships, and goal setting, all critical aspects of adolescence development. Theories play a vital role in helping us understand why depression develops and how it persists. For this discussion, we will focus on Beck's cognitive theory of depression, which offers valuable insight into how patterns of thinking shape emotional experience and behavior in adolescence. That revolutionary theory concept introduced the cognitive triad, which is a central construct of the theory. This triad is not simply pessimism, but a structured pattern of biased cognition that filters experiences through a negative lens. For example, an adolescent may internalize failure on a test as evidence of being unintelligent or hopeless, reinforcing a broader sense of inadequacy. This ongoing cycle of negative thinking reinforces feelings of helplessness and worthlessness, making it difficult for young people to recover independently. Consequently, the persistence of such maladaptive thought patterns contributes to the onset and maintenance of depressive symptoms, such as prolonged sadness, loss of motivation, social withdrawals, and regression to earlier developmental stages. Another important construct in Bach's framework is negative schema. A schema is a mental structure or framework that helps individuals interpret information based on prior experiences. A schema is particularly reflects one internalized belief about self-worth and competence. When adolescents from negative self schemas, often shaped by earlier experiences of rejection, neglect, or criticism, they tend to interpret new situations through a distorted, self critical lens, perceiving an even neutral feedback as confirmation of personal failure. These constructs collectively explain how more adoptive cognition patterns from a self-perpetuating system of depression, one that distorts perception and inhibits emotional resilience. Furthermore, depression in adolescence can have long-lasting implications. This increasing prevalence of depression among the young people is accompanied by high rates of comorbidity with anxiety, conduct disorders, and substance misuse. Untreated depression may impair educational attainment, career development, and physical health. across the lifespan. Beck's theory also highlights the left life blame and self-criticism intensify depressive symptoms, creating a feedback loop between cognition and mood. Therefore, intervention that address cognitive distortion at an early age are crucial to preventing chronic psychological distress. Adolescents may selectively focus on negative details while dismissing positive ones, creating an internal narrative of failure or rejection. The Open University notes that this interaction between cognitive triads and negative self schemas disrupts core cognitive process such as perception, memory, and problem solving, reinforcing a fixation and negative experiences. However, Beck proposed the negative self schemas develop primarily from adverse experience such as abuse, neglect, bullying, harsh criticism, or bereavement. These experiences shape how individuals process and evaluate future events, often leading them to attribute setback to personal flaws. However, negative beliefs and expectations may be acquired in childhood as a consequence of a traumatic event, also can predispose the individual to depression. As a subsequent stressful life event or a critical incident in later life can act to trigger the schema and activate systematic negative bias thinking, whereby the individuals tend to focus selectively on certain aspects of situation or event while ignoring other relevant information. Negative thoughts will often persist even in the face of contrary evidence. These cognitive distortions, example systematic negative biases in thinking, can be self-defeating and a significant source of anxiety or depression for the individual. Schemas often develop because of fundamental psychological needs such as connection, autonomy, and securities were not adequately met during childhood. As a result, these cognitive distortions persist even in the face of contradictory evidence, making them particularly resistant to change in clinical terms. This pattern of systematic negative bias becomes self-reinforcing and contributes to the chronicity of depression. The content-specified hypothesis of the cognitive model of depression predicts that depressed individuals view themselves as worthless, useless, and a failure, but we are not aware of any hypothesis about another negative attitude that depressed young people might use to describe themselves weak or stupid. The resulting outcomes, such as beliefs through irrational, exert a powerful influence over behavior and emotional, often leading adolescent to withdraw socially, avoid challenges, or engage in self-defeating behaviors. This connection will result in distorted thinking, disturbance in cognitive functioning, fascination with the negative experiences, regular episodes of depression during stress, emotional helplessness, chronic depression, social detachment, avoidance, and maladaptive patterns in the behavior. The interventions for this, based on cognitive theory, two main areas for intervention change: the cognitive triad, addressing negative views of the self, future, and world, and negative schemas, challenging deep rooted belief and maladaptive thought patterns. Initially, Beck practiced psychoanalysis, which focuses on unconsciousness motive. However, he observed that this approach often failed to help patients with depression. Consequently, he developed cognitive behavior therapy, a structured goal oriented method designed to identify, challenge, and modify dysfunctional thoughts, emotions, and behaviors. The CBT operates on the principle that changing adaptive thought patterns can directly influence emotional well being and behavioral outcomes. One effective CBT technique is cognitive restructuring, which involves examining the evidence for an evidence negative belief. For example, an adolescent who believes I am unlovable is encouraged to consider supportive relationships and achievement that contradict this belief. This reflective process gradually weakens the cognitive triad and fosters self compassion. Another therapeutic technique is behavioral activation. It's a psychological approach that emphasizes engaging in purposeful activities to elicit positive emotions rather than waiting to feel motivated. Individuals are encouraged to take action first, thereby experiencing the emotional and psychological benefits to these behaviors. The underlying principle is that intentionally participating is meaningful for enjoyable activities. Moreover, schema therapy is helping patients to understand their emotional core needs and learn ways of getting needs met in an adaptive manner, or to help them deal with the frustration if needs cannot be satisfied. This requires breaking through long-standing emotional, cognitive, and behavioral patterns, meaning change of dysfunctional schemas, coping strategies, and modes. According to the mode therapy model, there are specific goals connected with every mode guiding the treatment. In summary, both schema and CBT therapy focus on restructuring negative cognitions, but schema therapy extends this by addressing emotional and relational patterns developed in childhood. Together, they aim to restore healthier cognitive framework, improve emotional regulation, and strengthen interpersonal functioning. Adolescent depression is a multifaceted condition that profoundly influences emotional, social, and cognitive developments. Beck's cognitive theory provides a robust framework for understanding how negative schemas and cognitive trials interact to maintain depressive states. By recognizing and addressing these maladaptive patterns through evidence-based interventions like CBT and schema therapy, families and clinicians can work collaboratively to promote resilience and emotional well-being. Furthermore, early detection and supportive family involvement are vital in reducing stigma and encouraging help seeking behaviors. As understanding deepens, the focus must remain on empowering adolescents to reconstruct their healthier self beliefs, and view their futures with hope, competence, and optimism. Thank you.